The brain is vulnerable to many types of damage, and yet there are instances in which the brain appears to be remarkable in its resiliency. Many introductory psychology textbooks relate the story of Phineas Gage. Phineas Gage is probably the most famous person to have survived severe damage to the brain. He's also the first patient from whom we learn something about the relation between personality and the function of the frontal lobes of the brain. Phineas Gage was a foreman on a railway construction team. In 1848, an accidental explosion of a charge he'd set blew his tamping iron, a 3.5-foot metal bar, through his head. The tamping iron went in point first under his left cheekbone and completely out through the top of his head, landing about 25 to 30 yards behind him. Though he survived the brain damage, his personality changed. He became profane, impatient, and obstinate. His friends said he was no longer Gage. While arguably the most famous survivor of such damage, there are more contemporary tales of similar events. The pictures shown here are of a construction worker who survived a rod dropped from above, and a teenager whose friend accidentally shot a spear gun into his brain. These stories could have ended far worse. If the projectiles had severed a major blood vessel or damaged lower areas of the brain critical for life-supporting functions, death would have been almost certain. Let's now examine some other forms of brain damage. Strokes are an interruption of brain's blood supply as a result of bleeding or sudden blockage of a blood vessel. Neurons die largely because of an excess of glutamate activity. Though glutamate is one of the most abundant neurotransmitters in the brain, it's normally stored safely within neurons. When it spills from damaged cells, it causes a cascade of reactions in healthy cells that ultimately lead to cell death. As researchers develop a greater understanding of the biochemical process involved in stroke, novel treatment methods are being tested, such as cooling the brain to about 94 degrees, using THC to decrease the production of glutamate, and the use of stimulants to increase activity of surviving neurons. Head injuries can take one of two forms: open head, i.e. penetration, and closed head, concussion. Concussion does not have to be the result of a single forceful impact, like in a car accident. There is increasing concern over the cumulative effects of repeated header practice in soccer training. Additionally, some people may simply be more vulnerable. Genetics may also play a part in the severity of neurological damage. Symptoms of brain tumors occur if the tumor directly damages the nerves in the brain or central nervous system, or if its growth imposes pressure on the brain. Symptoms may be subtle and gradually become worse, or they may occur very rapidly. Changes in behavior, unexplained headaches, seizures, vision disturbances, or vomiting may all be symptoms of brain tumor. Tumors are due to accelerated growth of cells. Gliomas, formed from glial cells, account for about 45% of all tumors. Meningiomas, arising in tissues of the meninges, are typically benign and easier to remove surgically. Not all tumors can be surgically removed. Chemotherapy uses drugs to kill cancer cells, but it's not an effective initial treatment for brain tumors because the standard drugs have a hard time getting to the brain through the blood-brain barrier. Newer delivery methods overcome this problem by inserting chemotherapeutic drug-soaked wafers directly into the surgical cavity after a tumor is removed, delivering drugs directly into the spinal fluid, or administering chemotherapy into arteries in the brain using tiny catheters. Brain infections can take many forms. For example, parasites, e.g. pork tapeworm, encephalitis, inflammation of the brain caused by viral infection, e.g. West Nile virus or herpes simplex, meningitis, which can be bacterial or viral, even fungal, and mad cow disease. Researchers believe that the infectious agent that causes mad cow disease is an abnormal version of a protein normally found on cell surfaces called a prion. For reasons still unknown, this protein becomes altered and destroys nervous system tissue in the brain and spinal cord. Common methods to eliminate disease-causing organisms in food, like heat, do not affect prions. This photo shows a human brain overrun with cysts from the pork tapeworm. There are an estimated 1,500 to 2,000 people with these pork tapeworm cysts in their brains. A blob in the brain is not the image most people have when someone mentions tapeworms. These parasitic worms are best known in their adult stage when they live in people's intestines and their ribbon-shaped bodies can grow as long as 21 feet. The alarming illness occurs when tapeworm larvae lose their way, burrowing into a person's bloodstream and getting swept through the body. Often these parasites end up in the brain, where they form cysts. As a tapeworm cyst grows, it may push against a region of the brain and disrupt its function. It may get stuck in a passageway, damming the flow of cerebrospinal fluid and causing hydrocephalus. Still want that pork chop? I'll finish this section by briefly discussing intentionally inflicted brain injury, the lobotomy procedure. This was developed in the 1930s and was popularized by Dr. Walter Freeman. Lobotomies involve the severing of nerve tracts in the brain, tracts that connect the frontal lobes with deeper brain structures. Though the original lobotomy procedure involved cutting a small hole in the head, Freeman devised a simpler method, the transorbital lobotomy. He reasoned that there was no need cutting a hole in the head when holes already existed. The new method involved going up under the eyeball and through the orbit of the eye, a procedure that could be carried out in 10 minutes. In an age where there were very few effective treatments for severely disturbed patients, this procedure became very popular. In 1949, over 5,000 lobotomies were performed. Freeman performed as many as 25 in a single day. As the procedure grew in popularity, it was extended to others beyond the incurably mentally ill. Nor was the operation restricted to adults. A number of children were lobotomized, one of whom was just 4 years old. The procedure lost favor with the introduction of Thorazine in the mid-1950s, which, due to the popularity of lobotomies at the time, was marketed as the chemical lobotomy. Howard Dully was 12 when his stepmother took him to Freeman, who quickly agreed to lobotomize him. In a compelling audio story on NPR, Howard discusses the experience and how it has affected him. For many of us, this treatment seems barbaric. We believe that we are leaps and bounds beyond this primitive approach. But it will be interesting to see how people reflect back on our current practices 50 years from now.